What causes chest pain? Well, there are a lot of things that can cause it. I'm going to tell you some of the most common causes of chest pain in this video. I want you to watch to the end because I'm going to tell you one of the most, if not the most common cause of chest pain at the end. So don't go anywhere, guys. I'm Dr. Jen Caudle, practicing family physician. It's good to see you. Okay, in no particular order, let's talk about chest pains. Muscle pain. This is something I see with my patients. Maybe you start a new gym workout, you start a new yoga move, you're lifting because you're moving apartments, whatever the case is, you get a muscle strain in the chest area. This can cause chest pain. So, muscle strains, muscle pains, pulled muscles in the chest area absolutely can be a cause of chest pain. But there are other things as well. Let's talk about lung issues, okay? When we talk about lung issues, believe it or not, pneumonia. Yeah, pneumonia causes fever often and chills and cough and fatigue, but it can cause chest pain, chest pressure in some people. Also, pleurisy, which is an inflammation of the lining of the lung tissue, and even asthma. So, especially patients who are in the middle of an asthma attack, you get that narrowing of the airways, which can make you feel like you have pressure or chest pain. But staying along sort of the lung stuff and the lung as an organ, let's talk about pulmonary embolism or blood clots. Blood clots in the lung not only can be life threatening, but they can cause chest pain or chest pressure. It can feel like sort of someone sitting on your chest or chest pain. Of course, lung blood clots are very, very dangerous potentially. But yes, they can cause chest pains. Moving on, anxiety. Gosh, if I had a dollar for every patient who told me that their anxiety attacks, their panic attacks, they got chest pains or, sort of chest sensations, gosh, I'd be a rich woman. It's not uncommon to feel a tightness or chest pains during heightened anxiety or panic attacks. Now, I would be remiss if I didn't mention cardiac chest pain. That's things like heart attacks. Of course, that's certainly one of the things we worry about most with chest pain. But there are also other heart conditions that can cause chest pain, aortic dissection, and others. Again, I know I don't have to tell you, heart attacks, aortic dissection, etc., those are all very, very serious conditions, but they can be causes of chest pain, of course. There is something called costochondritis. This is an inflammation of the costochondral junctions, which is where the ribs meet the cartilage. This can cause chest pains in addition. And let me tell you this. Um, if you get chest pain, what you need to do is be evaluated by a physician right away. The reason why is because as a family doctor who's been in practice for a lot of years, I don't know that it's always possible to determine that your symptoms are not dangerous just by watching a video online or reading symptoms online. It is very, very important that you be seen by a medical professional in the emergency room. You call your doctor, you get help right away so your doctor can help determine if this is something emergent and potentially life threatening. Because remember, some of the things that I have mentioned as causes of chest pain are life threatening, potentially heart attacks, right? Pulmonary embolism, and so much more. Okay, now to the last one I wanted to mention, which is one of the more common causes of chest pain. It's acid reflux. Okay, acid reflux, GERD, gastroesophageal reflux disease. If you think about it, acid reflux often happens in this esophagus area. People get heartburn, essentially. The pain, it's like a burning right in the chest area, and it is commonly mistaken for, say, heart chest pain or cardiac chest pain. Once again, as I mentioned, yes, it's a very common cause of chest pains. But again, chest pains, you may not be able to determine if it's safe chest pain or not safe chest pain. So, the safest thing to do if you get any sort of chest pain is to get to an emergency physician, get to a physician right away so they can check you out, can do a full workup that's imaging, labs, etc. I should also say that these aren't the only causes of chest pain. There are others. I didn't mention them all. This was just to get you started. Guys, I hope this is helpful. Let me know in the comments. I'm Dr. Jen Caudle. Please share this video with others. Please subscribe to my channel on YouTube. I'm on Facebook. I'm on LinkedIn, TikTok, WhatsApp, Threads, you name it. Please also subscribe to my free health newsletter at drjencaudle.com.